Welcome to the Zebra Crossing. Today with us we have Dr. Ekta Dere Wable, a consultant gynecologist and fertility specialist at Wable. She is the director at Sanjivan Hospital. She is often mentioned as a doc-pernuer, as a doctor and an entrepreneur. Welcome to the Zebra Crossing.
Thank you.
First of all, can you tell us a little bit about yourself and your education?
So I'm a practicing gynecologist and infertility specialist from Sangamner. It's a small town in Maharashtra. I'm here since last 10 years. I've completed my gynecology post-graduation from D.Y. Patil Institute, Pune.
Okay.
And then I have also done my 3 years of job in Ruby Hall Clinic. Also right now I've just trained myself in infertility as an IVF specialist, where we are going to start our own center in Sangamner.
Okay. How was your journey to becoming a doctor?
Becoming a doctor was very challenging as such, but I had a great support from my parents, and of course my post-graduation was after my marriage. So my husband and his family were also equally supportive. And yeah, the only thing is that you have to study a lot when you become a doctor. But I think once you work hard, this is possible.
Okay, wow. As a gynecologist, what advice would you give to youngsters like me or kids in the adolescent stage about their health?
Okay. So in gynecology only, because adolescent girls or adolescent health is a separate arena, the separate area where we deal with it, because you also know that in adolescence there are a lot of physical, mental changes that a girl goes through. There's menstruation that starts, there are body changes, skin changes that happen during adolescence. So adolescent for a girl to manage is mostly, it depends on how she is coping up with her lifestyle, how she's eating well, how she's exercising. These are the things that need to be taken care of when you're in your adolescence, because this is this initial days which are preparing you for your future reproductive health that a girl has to face.
Okay. I'm hearing a lot about PCODs now. What is the whole buzz about? Why is it so hyped up?
So yeah, you're right. Actually, PCOD has sprouted up a lot nowadays when it comes to girls, and the main reason for this is the lifestyle. So PCOD basically is a polycystic ovarian disease or polycystic ovarian syndrome. There's a group of symptoms that a girl has, like weight gain. There are problems in their menstruation cycle. Then there is acne, hair loss. So these are group of symptoms that are, and there is also changes in the ovary. Okay. So there is cystic fluid-filled cysts, that multiple slits that are formed in the ovary. So all these symptoms together is called as PCOD. Okay. So it is of course mainly a lifestyle disease, and because today's youngsters, they don't have a fixed and a good lifestyle. They're eating a lot of junk food, so they don't maintain a proper fitness regime. They don't sleep well. So these are the things that are happening.
Okay. You mentioned PCOD as being a lifestyle disease. What is a lifestyle disease and how can it be prevented?
See, lifestyle disease is something that is related to your daily routine or a daily rituals that you follow. But we all know that today the youngsters, they have their own challenges, amount of studies or amount of workload that they have. So they're not able to maintain their daily routine well. Like they don't eat food on time. They don't try to consume all the healthy stuff that is available. They're more into junk food. Screen time has been increasing. So because of all this, they're not sleeping well. So all this costs you on your lifestyle, and because of this there is a hormonal imbalance in your body. Okay, and because of this juggling of your hormones, you end up having PCOD or insulin resistance for that matter. Okay, where this hormone called as insulin, it does not allow the blood sugar levels to balance. So then you get into an insulin resistance because of PCOD.
How is insulin resistance and PCODs related?
Okay, so insulin itself is a hormone which is imbalanced because of all these lifestyle changes that happen, and this is the reason that your blood sugar in the is not maintained. Okay, this finally leads to increased blood sugar, that is diabetes.
Okay, so can we say in other words that PCODs can later turn into diabetes?
Yes, of course, if not taken care and if not monitored well, it can surely lead to insulin resistance, which in turn one finally is going towards diabetes.
Okay.
So basically you can say that it's better to manage PCOD in adolescence than to further get into the complications.
Okay, got it. You had mentioned before that you are an IVF specialist and you have also opened a center right now in a rural area. Can you enlighten us a little bit about that?
After being a gynecologist and obstetrician for 10 years, I finally got into infertility recently. The reason being that my OP had a lot of these patients. Okay, infertility is even hitting the rural area. It is a very big challenge to open an infertility center in a rural area because of the technicalities that a IVF lab should have. But we are coming up with our own center soon, maybe in a month's time, in the name of Mommable IVF Center.
Okay.
So I hope we do well, and we have a lot of patients which get good treatment in the rural area itself.
Okay. I often hear that doctors don't have a good work-life balance. What do you have to say about this?
Yeah, I think that is a better question to be asked to my son actually. We have our own challenges, and because of the time constraints, it is there that it's very hard to keep up a work-life balance. But as every profession, this profession also has its pros and cons. Whatever little time we get, we have a micromanagement plan, for everything that we're doing. So even if we want to spend those 2 hours at home, we have to keep, ourselves updated right from beginning. So we have this something called as coping up systems. So we spend those 2 hours with quality with our family. So it's not always about quantity of time, it's majorly the quality of time that we spend.
True quality family time. Other than being a doctor, what are the other things that define you, your hobbies or your interests?
I always wanted to be a doctor, but there have been 14 years that we are studying medicine. So as youngsters we didn't get to do a lot of things that we wanted to. So I have taken up some special interests after being settled in our practice. I do a lot of gardening firstly.
Okay.
I have my own little garden, and I'm also into teaching entrepreneurial skills to women entrepreneurs especially. I've taken up trainings for the same from some American trainers like T. Haveker. Okay, so after I got trained myself to how exactly do a business, I also train my fellow colleagues and other women. I take seminars for them where I teach a lot of business systems, or something called as I support them for their business ideas.
Okay.
Yeah.
What are some of the challenges you faced in your journey and how did you overcome them?
Um Challenges, I don't take them as challenges, but they just when you're being a doctor, when you're a mother, when you're a social person, the only challenge that you have in India is time. As you even so every time we have to set up priorities. So whenever there is a challenge, like being a doctor, I had to take care of my baby. So that was one challenge, how to balance both, being a doctor and my raising my kid. So I had a lot of support and I overcame that.
Okay.
Similarly, setting up IVF in a rural area, I had to start from scratch, right from the permissions, or maybe how will it how have we had to do a survey whether this will work or no. So this was one of the challenges, and I think all other challenges were okay. I could tackle them.
Okay.
Yeah.
Kids nowadays are hesitant to take up medicine for further studies because of the immense amount of coursework and the long hours you have to spend studying.
Yeah.
How rewarding is it to become a doctor?
Oh my God. So yeah, basically being a doctor in itself is I would say that it is a gift.
Okay.
When you're studying, of course I too, as I mentioned, I have studied for last maybe 12 to 14 years to become a complete package as a doctor. I completely agree that there's a lot of time that you have to give, a lot of hard work, dedication is required in this field, but it is equally rewarding when when you have touched a human life. You deal with humans here, you deal with a life here, so the job satisfaction is enormous. I mean, when you see a patient recovering out of an illness and going out of the hospital smiling, I think that reward is, I think, more than any monetary gains that you have in other professions. And secondly, now being a doctor and a gynecologist and obstetrician, when you give birth to a baby, when you're delivering a baby, so I think when you're delivering a new life, that is more rewarding, and none of the professions can beat this happiness.
Wow.
So I think more and more kids like you should take up medicine, because medicine itself is very, very rewarding. Secondly, it's a secular, safe kind of a profession. You get a lot of respect, love and support from the society. And yeah, of course, I think most of you people should join medicine.
Okay.
Yeah.
What advice would you give to kids like me?
See, for you people, there is cafeteria of choice where it comes to your career. But my suggestion is that see your likelihood where exactly it is taking you. And this right brain and left brain, I think we know about it, that right brain people are more creative, into creative field. I think doctors also should have the same, creative people should come into this field.
Okay.
Because medicine and creativity goes hand in hand. So I would suggest, and I would like all of kids to always light up yourself and think medicine as one of the career.
Okay, wow. Do you have any final thoughts or key takeaways that you would like to share?
Firstly, though, I'm very proud of you that you're doing such a wonderful job with this zebra crossing.
Thank you so much.
I mean, it is such a creative idea, and at this age, so I congratulate you for the same.
Thank you.
And yeah, keep contributing in this world and doing your best. All that matters is how best you are at what you are. So that is it.
Okay, that's all the questions I had for you. Thank you so much for your time today. It was wonderful talking to you.
Thank you so much.
Thank you to our audience for tuning in today. Do like and subscribe if you liked the video, and leave a comment of what else you would like me to talk about. Thank you.